we're stuck.
Stuck in quarantine, waiting for arrival test results 9 days after returning from a Christmas trip to see grandparents.
What are we spending the money on? What are we expending the resources on?
It's a question more and more people are asking, with testing capacity stretched and some symptomatic people unable to get a PCR test, while returning travelers already have a negative one taken within 72 hours of arrival. Except for a small spike at Christmas, traveler test positivity rates hover around 1% and often less, while community positivity rates are now at 28%.
It's much better to direct those PCR testing and the things available at airports to population testing. We're kind of flying blind to try to keep flyers to get them tested.
Tracking every case isn't really necessary for a surveillance perspective.
Canada's top doctor says testing a sample of returning travelers may be a better way to go.
It is a capacity drain on the systems as a whole.
While the health minister refuted that in an interview on the West Block.
Those resources that we're using at the borders to protect Canadians and to protect people traveling through the borders, those resources are different from the resources that provinces and territories have access to. They use their own resources, we use our own resources.
The president of the Canadian Chamber of Commerce isn't buying that, given the overall backlog at labs.
When all that you have is a hammer, everything looks like a nail. And to be seen to be doing something has been focusing on the border instead of saying rationally, how should we be using our resources?
The Chamber of Commerce is part of the Canadian Travel and Tourism Roundtable, which this week called for an end to on-arrival PCR tests. Dr. Tam didn't go so far as to recommend that, but said she would advise against using resources to sequence every traveler test, given Omicron is so prevalent everywhere. Abigail Bimman, Global News, Ottawa.